My name is Dr. Catherine Hall. I am the clinical lead for end-of-life care at North Tyneside's clinical commissioning group. Today's event has been about professionals in health and social care and voluntary settings sharing the knowledge about the services and supports out there for our end-of-life patients. End-of-life patients and their carers and their family go through very difficult situations, and what's really important is that they then become aware of what support is out there for them. They need to be able to express what their choices are, where they would like to be cared for, where they would like to die, what other worries and concerns that they have, and they need to know that there is a support out there that they can access to help them with this in this very difficult time of their lives. Today's event has shown that in North Tyneside we have those services around us, and although we're not complacent and there's still many things that we can improve and develop, we have provided our patients the opportunity to allow their expressions of preference to be captured and shared so that their care is how they would like it to be. And it's been great that we've been able to pull this event together and celebrate all the partnership working that's been taking place in North Tyneside around our services and supports for our end-of-life patients and their families and carers. We've worked closely with our partners, Northumbria Healthcare Trust, North Tyneside Adult Social Care, Macmillan Support and the CCG to pull today's event together, and we're really proud of what we have achieved so far for our patients.
My name's Mark Lloyd. I'm from the Macmillan Welfare Benefits team at North Tyneside Council. The Macmillan Welfare Benefits team is a service that's designed to help people that have got cancer or affected by cancer or a palliative condition, to help them with financial problems that they may have. We maximise benefits for patients, as well as fill out grant applications and help the whole family wherever we can. In terms of benefits for clients, a lot of the work that we do is around attendance allowance and personal independence payment, and this can pay up to £139 per patient. And in addition to that, it also acts as a gateway to other help, in which they can get help with their housing benefit, council tax, pension credit and access to other services. There we've raised upwards of £11 million since the service has been set up, and have seen over 730 patients a year.
Hi, I'm Steph Downey. I'm Senior Manager for Personalisation with Adult Social Care in North Tyneside Council. I've been talking today about the Care Act, which came into effect in April 2015, and how that links with our end-of-life services. And in particular, I've been talking about our Macmillan Social Work Service. The Macmillan Social Work Service was a real opportunity to do something new and different in North Tyneside. We've worked very closely with Macmillan and with our NHS partners, and most importantly with the clients and carers who use the service, to make sure that we were able to develop a brand new service that works seamlessly between the council and the NHS in delivering good quality end-of-life care to people in North Tyneside. It's been a brilliant opportunity. As I say, we've had excellent feedback from the partners that we work with and the people who use the service, so I'm really proud to be able to be here today to promote that service and to make sure that more people hear about it, so that it can be there for people at that crucial point when they need that support.
I'm Dr. Paul Pace. I'm Head of Service for Palliative Care in Northumbria Trust. I've been talking today about partnership working that we've been doing around the initiative Deciding Right. This has been a regional initiative, and it's about really trying to empower patients to be able to make decisions ahead of time. Before we launched this initiative, we had problems where patients who wished to express their wishes had no real means of doing so. They had to encounter different organisations who didn't recognise documents that they produced. We now have 3 regional documents that are being used in North Tyneside, where people are able to express their wishes, and all services, including the ambulance and out of hours services, will recognise that. Part of that initiative has been about training and developing healthcare professionals who've got the skills to be able to have those discussions with people and do them sensitively, but also to try and capture them and be able to share them. So we've introduced 3 documents. One's an emergency healthcare plan, which sets out how people would want an emergency to be managed and guides healthcare professionals in doing that. The second document allows people to refuse particular treatments that they might wish to do so in an emergency. And the third is about do not attempt resuscitation. That's a document that's been developed regionally and is used across the North East now and successfully in North Tyneside. Northumbria Trust has been developing palliative care services over the last few years. We've embarked on a full service review and started off by launching 2 hospital palliative care units. These are the first in the country, and they're designed to provide inpatient care for those people who can no longer be managed in the community or have a specific need for a short period of time to be there. They've been well received both by patients but also by healthcare professionals. Before we opened those palliative care units, we had a major problem with patients having to be admitted through accident and emergency to acute hospital settings and not meeting their needs. We've managed to turn that round and become very popular with patients and transform our ability to manage people in the setting that they choose to. Alongside that, we've launched a new hospital palliative care service in partnership with the Marie Curie Cancer Care charity. We're the first trust in the country to launch a joint partnership with them, and by doing that we've changed our hospital palliative care team. That's enabled us to look after a broader range of patients and get them home if that's their preferred place. We've managed to blur some of the boundaries between hospital and community by having the staff able to follow people at home and then hand over their care to the GPs and district nurses, so it becomes much more seamless for them and hopefully makes families feel much more secure, and the feedback to date has been very positive. Over the last 2 years we've been trying to improve the care in the very last few days of life. We've been working with our partners across North Tyneside and across the region to both embed high quality education and training, but also have a new document that supports that. That's called the Caring for the Dying Patient document. That's been very successful as being another document that is used across all settings and means that when patients are at that very vulnerable stage, if they move home or go from home to an inpatient unit, the care will continue seamlessly. Alongside that, we've introduced a drug chart that enables us to be able to prescribe and deliver medication that's crucial in those last few days, and that's recognised across all organisations. We're doing a lot of work around evaluating that, of working with carers to make sure that care at the end of life is as good as it can be.
Hello, my name's Mike Wilson. I'm the service manager for the social work service for Macmillan. I think one of the most important things which the social workers bring to this area of care is a fully integrated service which involves social care professionals and medical and nursing staff. It has huge benefits for patients and carers in terms of recognising the multiplicity of their needs and ensuring that we provide the best quality of care across the board.
Hi, my name is Pam Ransom. I'm an end-of-life clinical nurse lead for the nursing homes in North Tyneside. This team was set up in 2012 at North Tyneside CCG initiative to enable and empower the nursing home and residential home staff to deliver evidence-based best practice end-of-life care to the residents in their care homes. Part of our involvement involves delivering the 6 Steps to Success programme to the staff within the care homes in North Tyneside. This programme of education aims to improve service delivery to this client group. It discusses the 6 steps within the mantra of our end-of-life care strategy from 2008 to enable staff to deliver gold standard evidence-based practice. Improving end-of-life care is everybody's business, and what this programme aims to do is to improve the care, particularly for the old, elderly and frail living within our care home populations. End-of-life care should be equal for everybody, and the aim of this programme is to promote that within North Tyneside.